The next that I have now is, the name happens to be the second symptom today. It is going to be Genitourinary Syndrome of Menopause, GSM. इसका पहले का नाम हुआ करता था, what you may already know, atrophic vulvovaginitis. It was his earlier name. This used to be the earlier name, atrophic vulvovaginitis. Vulvovaginal atrophy भी उसको बोलते थे, and there were multiple names, but now we prefer to call this GSM, Genitourinary Syndrome of Menopause. क्यों? There were multiple lesions. सबसे पहले तो उन्होंने बोला कि vulvovagina ऐसे बोलना पेशेंट्स को काफी बार अनकंफर्टेबल लगता था, ठीक है. The other thing was vulvovaginitis. ये itis का implication हो रहा था that there is inflammation and infection. Though there can be inflammation and infection, that is not going to happen always. The cause of genitourinary syndrome of menopause is different. उसमें कभी कभार infection और inflammation हो सकता है, which is why technically the term atrophic vulvovaginitis was wrong, and hence now we use genitourinary syndrome of menopause. Exam में भी तुम लोग atrophic vulvovaginitis मत बोलो, तुम लोग सिर्फ बोलो कि genitourinary syndrome of menopause. इसमें क्या होता है? सबसे पहले अपन सेम फॉर्मेट फॉलो करेंगे. साइंस एंड सिम्टम्स क्या होते हैं? तो साइंस एंड सिम्टम में सबसे पहले तो मेरा वल्वा, दैट इज वजाइना एंड वल्वा, ये दोनों एरियाज मेरे अफेक्ट होने वाले हैं. सो वल्वो वजाइनाइटिस है. सो जेनाइटल इचिंग होता है फीमेल्स को. क्या क्या होता है मैं पहले बताऊंगा, फिर क्यों होता है बताऊंगा. जेनाइटल इचिंग, दे हैव इंटेंस इचिंग इन द vulval region. Apart from that, they happen to, you know, get dryness, sensation of vaginal dryness. Vaginal dryness के साथ they feel burning. They also feel burning during micturition, जिसको मैं dysuria बोलूंगा. They get painful sexual activity, dyspareunia, and apart from that, they have multiple UTIs, that is urinary tract infection. ये सब होता है. So basically urinary system, genital system पूरा affect होता है. What is the cause behind that? Very interesting. तो इसका कॉज ये है, आपको एक बात याद रखनी है कि जो ईस्ट्रोजन होता है ना, ये ईस्ट्रोजन रिसेप्टर को बाइंड करता है, और ये ईस्ट्रोजन रिसेप्टर्स है ना सब जगह होते हैं बॉडी में फीमेल के. दे आर ऑल्सो प्रेजेंट ऑन द वल्वा, दे आर प्रेजेंट ऑन स्किन ऑल ओवर द बॉडी, they are present in the pelvic floor, they are present in the urinary bladder, they are present in the urethra, they are present in the endopelvic fascia, level 2 support जो होता है अपना डेलेंसी में, एंडोपेल्विक फेशिया में होते हैं. ऑफ कोर्स वजाना में तो होते ही है. दे आर एवरीवेयर, दे आर यूनिवर्सल ईस्ट्रोजन रिसेप्टर्स. सो व्हेनेवर देयर इज ईस्ट्रोजन डेफिशिएंसी इन योर बॉडी दैट हैपेंस आफ्टर मेनोपॉज, these estrogen receptors are not going to take it too kindly. These estrogen receptors will start having problems. So what was estrogen first of all doing in all these locations? There was a very important work it was doing, and that was, it was supporting collagen. Various types of collagen, one of them being elastin. Elastin को भी support करता था, collagen को support करता था. It used to support the health of the tissue. So whenever there was lack of elastin and lack of collagen, there was shrinking of the skin. Shrinking of skin. Shrinking बोलो या फिर you can even call it, there was shriveling. Basically there was thinning of your skin का texture. इसके वजह से wrinkling होने लगा, fibrosis होने लगा वो एरिया में. The stretchability, elastin is gone, the elasticity of the skin is gone. Elasticity अगर जाएगा तो sexual contact जब भी रखेंगे, the skin of your vagina, of your vulva is going to be stretched. It will be very painful for that female. Apart from that, it is also said that endopelvic fascia, the one that keeps the uterus and the vagina in its original location inside the pelvis, after menopause, why do females come to us with prolapse, pelvic organ prolapse, uterine prolapse? The reason is this endopelvic fascia. उसके अंदर जो भी estrogen होता है, I'll just draw a basic diagram. यहाँ पे अगर मेरा anteriorly bladder है, यहाँ पे मेरा uterus है और यहाँ पे मेरा rectum है, तो इनके बीच में there is this tissue, basically this endopelvic fascia, जो इसके पूरे आजू बाजू में सब जगह पे रहता है, सब जगह रहता है. ये ही है जो ईस्ट्रोजन में इसके रिसेप्टर्स होते हैं. इसके अंदर बहुत सारे ऐसे ईस्ट्रोजन रिसेप्टर्स होते हैं. सो व्हेनेवर दीस ईस्ट्रोजन रिसेप्टर्स डू नॉट गेट ईस्ट्रोजन, तब जाके ये ईस्ट्रोजन रिसेप्टर ना होने का, ऐसे ये जो एंडोपेल्विक फेशिया है ना, ये पूरी तरह से चला जाने लगता है, पूरी तरह से चला जाता है. ये पूरी तरह से ऐसे जाने के वजह से there is nothing to support the uterus now, and that leads to the support coming down. There is uterovaginal prolapse, there is cystocele, there is rectocele. Basically pelvic organ prolapse होता है. So pelvic organ prolapse हो गया, again sexual activity difficult होगा, urinary complaints होंगे. One more thing, the bladder and the urethra, इसका ये जो tissue होता है, all these epithelial cells, urothelium that we call it, उसका integrity is maintained by estrogen. So due to lack of estrogen, ये जो पहले ऐसा हुआ रहता रहेगा उनका urothelium with single lining ऐसा squamous epithelium, वो हो गया ऐसा डिस्टॉर्ट, ऐसा दूर दूर ऐसा खराब शेप का ऐसे हो गया. इसके वजह से द फीमेल स्टार्टेड एक्सपीरियंसिंग बर्निंग मिक्चुरेशन व्हेनेवर शी यूज्ड टू यूरिनेट, एंड आल्सो ये जो एंट्री पॉइंट्स बन गए, यहाँ से बैक्टीरिया अंदर जाता था, वजाना का बैक्टीरिया जो है. दिस वुड लीड टू इंक्रीज चांसेस ऑफ यूटीआई. One more thing. Inside the vagina, I have something called as Doddelin's bacillus. Doddelin's bacillus is what we have heard earlier, that it produces lactic acid and it keeps the vaginal pH acidic. This is what happens in the reproductive age group whenever there is female who has normal estrogen levels. उसमें lactobacillus बनता है, acidic pH vagina का maintain होता है, and that protects against बाहर के commensals. And that is when it is affected, bacterial vaginosis होता है. So whenever there is lack of estrogen, there is nothing to produce those Dodder's bacillus. So they die. And once they die, commensals from outside start coming in. They start coming in and females have recurrent vaginal discharge, leukorrhea, dry vagina, acidic pH खत्म हो गया तो bacterial vaginosis बार बार होता है. Multiple causes of leukorrhea also start occurring. So all these things are going to lead to the genitourinary syndrome of menopause. So how do I treat it? So again, as I mentioned that we have in treatment non-medical management. Apart from non-medical management, we also have, of course, we have non-hormonal management. Same headings. नीचे में hormonal आएगा, special drug आएगा. So non-medical में सबसे पहले the problem is that the vagina has lost all its capacity to make all the lubrication. The vagina has become too rough. It is stretching a lot. So what do I do? First of all, I give her lubricants. So whenever she wants to have coitus, she should use outer external lubricants. Apart from that, because the skin has become very parched, it has become very thinned out because of loss of elastin. So I would give her vaginal and vulval moisturizers. बाहर से ही लगाना बेटर है, moisturizers देना है. Apart from that, if she says that her vaginal size has shrunk, it has atrophied, and she is unable to have penetrative sex, then I will advise her to get or use vaginal dilators. Vaginal dilators in small to increasing size will help her maintain the length of her vagina even when she is not having regular coital activity. तो ये एक दूंगा. उसके बाद मैं वो थोड़ा फिजियोथेरेपी भी दूंगा. फिजियोथेरेपी, कीगल्स एक्सरसाइजेस दूंगा मैं. कीगल्स एक्सरसाइजेस आर गोइंग टू हेल्प इन मेंटेनिंग द, क्या बोलते हैं उसको, अपना यूट्रस इन इट्स ओरिजिनल लोकेशन. द पेल्विक फ्लोर इज नॉट गोइंग टू बी दैट वीकेंड. होगा वीक, एंडोपेल्विक फेशिया जो जा रहा है वो जा रहा है, बट अगर पेल्विक मस्क्यूलेचर, लेवेटर है ना, ये सब अगर हम स्ट्रेंथन कर दे तो पॉसिबिलिटी है कि द ग्रेड ऑफ प्रोलैप्स और द एज ऑफ प्रोलैप्स हम थोड़ा सा बेहतर कर सके. So that is why I'll be asking her to do physiotherapy and Kegel exercises. She says, I've tried everything, not working. Give me something really good. So what was the problem? She was having difficulty in having sexual activity. She was having a problem with her urination. So of course, non-hormonal mein I can give her antibiotics to treat her UTIs. So antibiotics दूंगा. यूरिन अल्कलाइजर्स दूंगा. अल्कलाइजर्स क्या होते हैं? सिटाल नाम का एक सिरप आता है, बहुत सारे सिरप आते हैं. सो यूरिन अल्कलाइजर ऐसी चीज है कि जब भी मेरा यूरिन अल्कली बनेगा तो वहां पे उसके अंदर ऑर्गेनिजम्स यूजुअली पैदा नहीं हो पाते. यूरिनरी ऑर्गेनिजम्स रिक्वायर एन एसिडिक एनवायरनमेंट. सो यूरिनरी अल्कलाइजर्स देंगे. उसके बाद में शी सेज दैट बिकॉज ऑफ दैट डिस्पेरोनिया, रफनेस, I am just now having a fear of having sex. I'm having a fear of having coitus because whenever I have coitus, I get pain. I don't want to have it, and hence I'm losing out my libido. Also remember that I told you that the ovaries also secrete testosterone. So whenever there is low testosterone in your body, it can lead to loss of libido. So what can I give? Obviously, I can give her oral testosterone because testosterone is the hormone that can lead to heart diseases and everything. It can also lead to acne, hoarsening of voice. It can lead to basically virilization, signs of masculinity आने लगेंगे. So I cannot be giving her testosterone. So what I can give her is DHEA analogs. DHEA is a weaker androgen that is produced by the adrenals. इसके analogs में दूंगा, basically उसके agonist दूंगा मैं उसको in कम quantities for her loss of sexual drive. इसके बाद में आते हैं hormonal पे. Mainstay of treatment. The problem has all been about loss of estrogen. The problem with hormonal is अगर मैं orally लेता हूँ मेरे liver में जाता है, thromboembolism कर सकता है, plus it is not good for heart as well, they say. I can solve the problem. The problem यहाँ पे is only in the vulva, vagina and the urinary tract. So what I can do is I can give them topical estrogen. Topical estrogen is basically मेरे पास multiple forms में. I can either give them in the form of a cream or I can give them in the form of a pessary. Pessary is a better word for that tablet that I'll keep in the vagina, or I can give them in the form of rings that they will place in their vagina. So topical अगर मैं estrogen उनको दूंगा, locally लगाएंगे, vagina के अंदर लगाएंगे, all of these are, this is put twice a week, this is also put twice a week, and this is to put once in 3 months. So whenever they use this, the systemic absorption is going to be very low, and that will also remove the need to give her progesterone. Progesterone की भी जरूरत नहीं पड़ेगी क्योंकि topical दे रहा हूँ मैं, and topical is going to have a great amount of action for these women. It is going to really help them. हाँ, कितना देना है आप पूछोगे, 0.5 ग्राम अगर twice a week लगाओगे तो 4 mg per kg, 4 mg per day of tablet, and जो रिंग है उसमें से 7.5 माइक्रोग्राम पर डे एल्यूट होता है, निकलता है. But just remember cream, pessaries and rings. Of course, if this is not working, then you can go ahead and give her oral, that is systemic estrogen. But remember that if she has a uterus, then of course she also needs to take it with progesterone. That is always going to be the last option. कैसे लेना है? I'm going to tell you all at the end. The question here is which is the special drug over here? Special drug कौन सा है यहाँ पे? The special drug over here is ospemifene. सब fiends ही है. Now this happens to be an SERM, selective estrogen receptor modulator. तो ospemifene देना है 60 mg per day. Dose नहीं याद रखोगे चलेगा. Ospemifene is something that is going to act only on your local vagina, local areas, and it is not going to act on your uterus. It is not going to act anywhere else. Local action बहुत है. A good drug, sexual drive भी थोड़ा बहुत उसे बढ़ जाता है. The special drug in the earlier case was bacidoxifene. यहाँ पे it is ospemifene. Fine.